So yeah, we're really excited to be here today. First off, we just wanted to thank you, Erica and Dorian, for giving us the invite to share some of our insights that might encourage you to kind of re-envision how you work with data in a First Nations context. Before we jump into things, we'll introduce ourselves quickly. So as Erica mentioned, my name is Maureen, my English name. I'm from Couchiching First Nation and I grew up nearby in Fort Frances. I have Ojibwe and European settler roots, and I don't know my clan. Usually I start off introducing myself in the language, so now I've done it backwards, but I'll just say quickly, Ani Morindindishnikaj, Jakanashi Mung, Gwajijing Ishnikadi Ishkonigan, Gawin Mashi Ninjkanamasi Nindudam. So it's my job through Mamoyamoin to share the knowledge that we produce through our work in a meaningful and accessible way. I'm a knowledge translation specialist. So I'll be the one kind of walking you through this alongside Christina, who I will let introduce herself now.
Thanks so much, Maureen, and thank you everybody for joining today. So my name is Christina Vlahopoulos, and I'm sure, as you can tell from my very Greek last name, that I'm of settler Greek ancestry. And I'm coming to you from the traditional lands of the Robinson Huron Treaty Territory and the traditional lands of the Atikameksheng, Anishinaabeg, and Wanapitei First Nations, also known as Sudbury. And so my role with Mamoyamoin is a supportive one as the project manager for the group. And it's an honor to be here today with all of you.
Thanks, Christina. I do notice that we have Beth and Yantao here, so I just wondered if they wanted to take a moment to introduce themselves quickly. They won't be delivering the presentation, but they are really integral members of our team, and they may be taking part in answering some of the questions you guys might have as data people. So I'll hand it off to Beth really quick, if you don't mind, Beth.
I'm in a hotel lobby having lunch in Winnipeg. I just arrived, so I'm a little frazzled, but here I am. So my name is Beth Rackless. I'm actually an epidemiologist, probably like most people on the call, and I am based out of ICS Central in Toronto, and I'm from Toronto. I am in Winnipeg this weekend visiting my stepdaughter, so we will be picking her up from school in about an hour and a half. And oh, hello, Christina. Sorry, I just got a message from an old colleague. And what can I say? It's a great group to work with. I'm really excited to be here, and hopefully I can answer. If I can be helpful, feel free to turn it over to me, Maureen or Christina. Thank you.
Amazing. Thanks, Beth. Sorry to put you on the spot, but we're glad to have you. And then Yantao, did you want to take a moment to introduce yourself really quickly?
Sure, thanks, Maureen. Hi, everyone. My name is Yantao Zhao. I live in the traditional territory of Atikameksheng, aka Sudbury, so I'm very close to Christina. I work as a data analyst in the team. It's a very lovely team to work with, and I'm very honored to have the opportunity to work with Indigenous people's data and to inform them with decision making and stuff. Yeah, thank you. Back to you, Maureen.
Thank you so much, Yantao. Okay. So we'll start with a bit of an outline. So we already gave you a bit of an introduction about who we are as individuals, but we will share more about the partnership as well, or sorry, alliance. We used to be called a partnership, and now we're moving toward the word alliance. So forgive me if I get a little bit mixed up with the terminology. Once we've kind of introduced ourselves as an alliance, we'll talk about some of the concrete projects that we've worked on. And then we'll use those projects as a foundation to share some of our insights about the data cycle. And hopefully those will be kind of inspiration for you to rethink some of the ways that you do things. Everyone works in a slightly different context, so not everything will be transferable, but some things will be, I suppose. And we hope that it at least gets you thinking. And then at the very end, we'll just take a few minutes to talk about what this has meant for communities and some of the applications of the data we've shared. So in terms of background, as I mentioned, we are technically called an alliance. We're an alliance of First Nations health and social service organizations serving communities across Northern Ontario. We formed back in 2016. And at that time, the partners, I say the partners instead of we, I wasn't there, but the partners or organizations came together because of this shared need for high quality community specific health data, because they didn't have the data that they needed to make evidence informed decisions, which was very problematic. And also worth noting is that this is data that typically most municipalities or non-Indigenous kind of groups or counterparts would have access to. So it was also seen as a kind of inequity that the group was hoping to resolve. Let's see here. I don't know why, but my notes are a slide behind, so just bear with me for a second. Oh wait, no, I'm so sorry. My screen was a screen behind. So you guys are seeing what I just talked about. Anyways, I will figure out what I'm doing one day. But we just talked about the background, and now we'll talk about the organizations. So the 11 organizations that make up the Alliance are pictured on this slide. As you can see, there is a pretty wide variety here. We have a mix of tribal councils, health service organizations, and more. And because this, again, is an alliance of the 11 organizations, they're the ones who make decisions that guide our day-to-day work. And the way that this happens is that each organization is represented by 1 or 2 steering committee members who meet on a monthly basis and discuss what we're up to, things that are upcoming to provide that guidance. And I'll hand it over to Christina for a second to talk about this map.
Thank you. Yeah, so the 11 organizations that were just on the previous slide, they collectively serve 78 communities across Northern Ontario. And so this map, and if you see me looking off to my side, it's because that's where I have the slides, the image of the slide. So this map highlights the 78 communities across Ontario. So the communities span all the way from the Ontario-Quebec border, the James Hudson's Bay coast, and all across to the communities that border Manitoba. And so Mama-Yamwin decided very early on that they really wanted to focus on Northern Ontario and be a Northern voice. And so they decided that they would only go as far south as the communities that are on the north shore of Georgian Bay, so the communities between Sudbury and Sault Ste. Marie. And this is because the needs of the communities in the northern part of the province are very unique compared to those in the southern part of the province. As a good example, for a good part of the year, some of these communities are only accessible by plane, or they have ice roads in the wintertime to be able to get to the communities. And so when we overlay this map with a map of Western Europe, you can get a better appreciation for the vastness of the geography that is this province of Ontario. And while there may be some similarities across Northern Ontario, when you look at this map, you can really see how the needs of the people within the communities can vary. So, when you look at this map as an example and you see somebody who's living in Italy, they wouldn't have the same healthcare needs or access to healthcare services as someone in, for instance, either the Netherlands or France or Germany. And so this image just really highlights the importance that we can't really paint all communities across Northern Ontario with the same brush and expect all of their needs to be identical. And so this is really important, especially for policymakers who may not understand the vastness and challenges for those living in Northern First Nations. And, when you think about things like access to healthcare or specialized services, the high cost of living and food, these are all other factors that are going to be different across the communities in Ontario. And as a side story, I was in Europe this summer, and specifically I was in Greece visiting family, and we were trying to sort of describe just how big Canada is, or just how big Ontario is. And I showed them this map, and until they saw it, it just really, they had no concept of just how big Ontario alone is. So it just really, highlights that the sheer vastness of the geography that where we live.
Thanks, Christina. Yeah, it's such a great tool that we like to share whenever we're presenting. So now you know a little bit about why we came together, who's involved, how the governance worked, all the stuff like that. We'll talk about what we actually do. So we work with communities to find, analyze, and interpret data in response to questions that they have prioritized following a culturally respectful path. And we'll break this down throughout the next couple of slides. So the first thing we'll break down is the word data. These are slides we use for all our presentations. Most of you guys are EPIs, so we'll go over this really quickly. I would imagine we all know what data is, but it is the plural form of the singular noun datum, which really just means a piece of information. So when we bring more than one of these pieces of information together, it becomes data, and we can use this information for reference or for analysis. So in other words, information we use to better understand something that we might have questions about. As you all know, again, there are various types of data. We work with quantitative data and primarily with administrative data, which is basically any form of personal information that's originally collected for another purpose. So for us, this is health administrative data or data that was originally collected by the healthcare system. Again, I'm sure you all know this, but every time we interact with the healthcare system, so anything from like going to the doctor, visiting the emergency room, or getting a blood test, someone records information about that, and we can use this data in the work to answer our questions. So the reason that we use mostly health administrative data is because organizations and communities have told us that they want to know what kind of data about us is already out there and to make use of it rather than going and collecting new data. Of course, there's still lots of value in that, but they really wanted to start with what already exists. So again, as most of you know, in Ontario, there's an independent nonprofit corporation that collects health administrative data called ICES. Beth talked a little bit about this because that's where she's based. Formerly, ICES was known as the Institute for Clinical Evaluative Sciences. And the folks at ICES use health admin data to monitor and evaluate our health system. And they're allowed to do this because they are designated as what's called a prescribed entity under Ontario's Personal Health Information Protection Act. What's really important to note is that ICES has very strict policies and procedures surrounding the use of First Nations data. These align as much as they can with Indigenous data sovereignty principles such as OCAP. Most of you will know what that is because you've attended a really cool OCAP workshop that Erica and Dorian put together with the folks at FNIGC. If not, we unfortunately don't have time to go through it all today, but I would encourage you to look it up. But yes, they do their best to honor those principles, and the principles were created in close collaboration with the Chiefs of Ontario, who act as a kind of governing body in partnership with ICES over First Nations data. Again, it would really be beyond the scope to describe what the policies and procedures are, but please know that they do exist. You can't just go to ICES and say, I want to look at First Nations data, which is a good thing because it needs to be done in a good way, right? So just so you know, that is a factor in the work that we do. We're not going to discuss it here today, but we wanted you all to be aware. So when organizations or communities have questions about the health of their people, again, we work with ICES to figure out what kind of health administrative data is out there that might relate to their question. We look through these health administrative databases. Beth or Yantao would know. Many of you on the call actually might know what these databases are better than I do, so we won't go too much into detail there. But once we find some of those databases that has information we need, we link this to data from the Indian Registry, which is maintained by Indigenous Services Canada. The Indian Registry has personal and demographic information about all registered status Indians in Canada. That's their language from the Indian Act, not our language, just to note. And once these databases are linked, any information about people's personal stuff, any information that could be used to identify someone, like names or health card numbers, are removed. Again, sure, you're all very familiar with those processes in your work. So once these two are linked, or not usually two, it's probably many different data sets, we can find people from our communities who are in all of the data sets to learn more about their health and to answer questions that communities and organizations have brought forward. Anything that I might have forgotten to add, Christina? Just want to make sure. Okay, awesome. Again, I'm sure you guys all know the basics of that whole process, but usually we're presenting to folks who might not have been exposed to it. So hopefully that's a good foundation. Now that we've talked about that, again, we're going to talk about some of our specific projects that we've kind of embarked on using those processes. So the first that we did was called Learning from Our Ancestors, and we might also refer to this project as the mortality analysis throughout the presentation. We use those terms kind of interchangeably. As you might kind of imagine based on the name, the focus of this project was the health of people from Mamo-Yamuan communities who had passed away between specifically the years of 1992 and 2014, because those were the years for which we had data at the time. The steering committee decided to focus on this topic for a couple of reasons. I'm going to let Christina touch a bit more on them later. But I also want to note before we move on that even though we serve 74 communities, is that right, Christina? 74?
At the time when we did this analysis, there were only 74 communities who were a part of Mamo-Yamuan, and then since then we've grown to include another 4 more communities for a total of 78.
Okay, thank you so much. I knew something about that sounded off, but I couldn't put my finger on why. So Christina is the expert. But even though we only served 74 communities at the time, only 59 actually participated in the analysis. And this is because we only linked data about people from the communities that opted into the project. So just because the community is part of our alliance, it doesn't mean that we can just go and do whatever we want with their data. The way we see it, all communities have the right to self-determination and to decide for themselves, usually by way of a band council resolution or another formal document, whether or not they want to participate. So based on their priorities and the findings from the mortality analysis, the steering committee did direct us to start on 3 more analyses on topics around chronic conditions, mental health and addictions, and injuries. 2 of these are actually underway right now, which is really exciting because they've all been put off for quite a while because of COVID. And those are the chronic conditions analysis and the mental health and addictions analysis. So we're actually just at the stage where we've gotten a few rounds of preliminary data back, which again is super, super exciting for some of the indicators that we've decided on in collaboration with different groups of people. I guess we'll get a little more into that very, very shortly. So now that you know at a really, really high level about some of our different projects, we're going to use this as a foundation to start thinking about the data cycle. So what this means is that for each stage of that cycle, we'll talk about how things are quote unquote usually done in a mainstream public health context. And then we'll contrast that with stories about how we've approached things based on our experiences with the projects that we just talked about. This is the framework that we're working with. We recognize that some people might split the data cycle up into different phases, more or less phases with different names. This is just what made sense for us, for our intents and purposes today. Even if you think of the data cycle a little bit differently, the concept should still be transferable. Another note is that while these categories are depicted on the screen as mutually exclusive, there's actually quite a bit of overlap, as again, I'm sure you guys all know, but we just wanted to kind of give that disclaimer. So the first consideration is always, what question are you trying to answer? You can't get data if you don't know what you're trying to find, right? At somewhere like a public health unit, research questions are often driven by program staff or leadership. They're in need of evidence to help them make decisions or complete other aspects of their jobs. Ideally, there would be some community engagement or input, and sometimes maybe there is, but that's not usually the norm, and that's not usually a driving factor for the work that's being done. So we try to flip this idea on its head and to shift the decision-making power. So it's always the organizations and communities' needs and priorities that are driving the research question. And I'll get Christina to share a little bit about what this process actually looked like for our analyses.
Yeah, so very early on, the group decided to come together and they had these questions in terms of accessing data. And so they had a number of indicators that they were interested in looking at. So whether it was diabetes, some had the cancer as a priority, some had cardiovascular conditions as their priority. And so they had in-person meetings at that time to sort of look at and talk about the different priorities they had. And so around that same time, Mamo-Yamuan was looking to a similar partnership out in Nova Scotia called the Dweekin Partnership. And it's I don't know if Tweakin stands for strength in numbers, but the tagline for their group is called Strength in Numbers. And so they were already a few steps ahead of Mamo-Yamuin in terms of the work that they were doing. And so they provided a bit of guidance to Mamo-Yamuin based on their experience. And so after some conversations with that group and taking a look at the indicators and the priorities that the Mamo-Yamuin Steering Committee had, they landed on looking at the mortality, landed on the mortality analysis. And part of the reason is because mortality isn't easily understood and it's a universal outcome. And it encompassed all of those priorities that all the steering committee members had at that time. And so it also provided that high level overview, and the group then thought that by starting here, it would then help to decide where they wanted to take a deeper dive for future analyses. And so once the mortality analysis was completed, we looked at the findings collectively and then decided to look at the 3 projects that Maureen previously mentioned: the chronic conditions, mental health and addictions, and injuries. And so it is this iterative process where, we keep in touch with the steering committee, they provide information, and it drives the work that we do.
Awesome. Thanks, Christina. So just to recap some kind of key reflection questions that you might ask about this phase of the data cycle are: whose needs and priorities are driving the question, and who holds decision-making power. So once you have your question, of course, you figure out where you can get data to answer it. So because we're using secondary data, we're looking at data sets and indicators used at ICES. In many cases, these indicators are associated with specific macros that have been created and validated by the wonderful folks who work there. And that's really helpful, but sometimes we do need to go a little bit farther than that. So I'll ask Christina to share another example from some of our upcoming work where we had to kind of deviate from the norm in order to meet the needs of our steering committee.
Yeah, thanks. So as Maureen mentioned, selecting the indicators is an important part of the process. And so after the group landed on these 3 projects, it was important to invite those who were doing the work. So whether it was like Beth and Yantao, who are here today, or the researcher whose expertise we were looking at or drawing from, we invited them to a steering committee meeting to talk about their work and what it would mean for that analysis. So a good example is in the early phase of the chronic conditions analysis, we brought information about the macro that ICS uses, and the steering committee actually came up with a few additional considerations. And so what this means is that the analysis will not only include a rich pool of information about a wide variety of conditions, more importantly, it's going to include the things that are important to them, and it's going to be relevant to their regions and their communities and what they experience in their regions and communities, and really address what they want, not just because that's what the macro says that we can do. And so, yeah, it's just really important to have that feedback from the steering committee.
Thanks, Christina. Yeah, and I think that, can you remind us of the conditions that weren't in the original macro that we decided to look at, if you know off the top of your head?
I do. So one of them was chronic pancreatitis, but the more, I think the one that was more universal for a lot of steering committee members was liver conditions. And although liver conditions is very broad, and we reached out to a researcher who that's her main focus in terms of, she's a gastroenterologist and hepatologist, and it's a very complex condition when looking at liver conditions. But we decided under her consultation to look specifically at liver cirrhosis as sort of a starting point. And then depending on what happens within this analysis, again, we might take a deeper dive in looking at other liver conditions like hepatitis C, and so on. Or there might be something else that comes up in the data that might drive us into a different direction. So.
Thanks, Christina. Yeah, I think that's really helpful to just kind of illustrate why we needed to go beyond that pre-established macro. And to the second point on the slide here, like any good researcher or epidemiologist or person who works with data, we're also thinking a lot about the limitations of our data and what the implications will be for how useful it is. So for example, with the mortality analysis, there were a few really important ones that came up. One important one was that it would have been really challenging to tell whether people in the data set lived inside of a community or outside. So ultimately, we decided not to break the data down by this factor for that analysis. However, we did keep it in mind moving forward, and we are trying to do something about this for this next upcoming analyses. So Christine will talk about this in just a second. But another important limitation was that because we're pulling from provincial health data, a lot of this relies on people having a health card. As some of you may know, not everyone who is eligible for a health card has one for a variety of reasons. In more remote communities, it's often because they have federally funded nursing stations, meaning that they're not actually interacting with the provincial healthcare system very much, if at all. Speaking of which, we also don't have access to data at the federal level, either from nursing stations or prescription data from NIHB. So even if people are interacting with the nursing stations, that is not data that we can access through ICES. It is something we've looked at, but it would require a much more involved process, and it would kind of be going into uncharted territory. So we'll see what the future brings with those. Just looking if there's any other limitations I wanted to mention. Those I think are the major ones, but just to kind of hammer this point home, it's really important not only to think about these limitations and what the potential implications could be, but also to communicate these very clearly to the steering committee members, as well as the organizations and communities that are going to hear about the results later on. And this is because it really helps to inform, it helps them make really informed decisions about our next steps, and also is going to inform the way that they interpret the data once it comes back. Sometimes when something is really important to them, we can try and find a way around certain limitations. Like I said, an example would be finding ways to determine who lives within the community versus who lives outside. Again, it wasn't possible for our first project, but we're really trying to make that happen for our upcoming ones. So when we share these limitations with them, they can tell us what's really important, and we can see if there's anything we can do about it, if at all. So moving on to the, I guess, third and fourth phases of the cycle. We've combined these two phases because they're really just so hard to separate, and it just made sense to talk about them together. So it's important to think through the decisions we're making with the data when we're talking about collecting and analyzing it. Even ones that are pretty standard or pretty regular and might seem harmless. So for example, it's really normal to establish some sort of comparison group to add context or meaning to the data, especially when we're sharing it with the public, right? A number often doesn't mean something unless you are talking about it in reference to another number. So in the context that we're working in, it usually ends up being a comparison between an Indigenous and non-Indigenous population, or First Nations people versus the general population, or something along those lines. These comparisons have the potential to be harmful if not approached carefully. That doesn't mean that they are going to be. Again, they have the potential to be, because they can reinforce negative stereotypes. But it is still important to understand the extent of inequities between First Nations and non-First Nations populations. So we're going to run through a couple of things you might want to keep in mind when you're thinking about this topic. You might hear people talk about strength versus deficit-based framing. This is exactly what we're talking about. And again, just a few things you can keep in mind. So the first is always ask the partners or communities you're working with. In our case, our steering committee asked for us to make comparisons like this because they wanted that information to help advocate for their communities. So they specifically asked for us to make comparisons not only with the general population across Ontario, but they also wanted us to be able to make comparisons with the public health unit kind of region that they're in, the LIN, which was the thing at the time, and other kind of comparison groups that they wanted to understand their numbers in relation to. So although in our case, the steering committee asked for this and they wanted us to make those comparisons, some communities might not want you to do that. So I had the privilege of working, just as an example, with a team of Indigenous researchers in Australia who were working on an evaluation of smoking cessation programs in Aboriginal and Torres Strait Islander communities. And they made the decision not to do this. And by refraining from these types of comparisons, they were actually able to show that there had been a pretty significant increase in the number of folks who had quit smoking in these communities. But if they had done the comparison with the general population, those improvements would have been masked because the differences are so great. So that's just an example of why it might be useful to not do a comparison in some instances. But again, it's always based on what the community wants and what's going to be useful to them. So if you ask the partner or community and they do want you to do a comparison, think about how you're communicating things and who has control over the narrative. So non-Indigenous organizations probably shouldn't be sharing this data publicly without consent and active engagement. When you think about, again, going back to OCAP and Indigenous data sovereignty principles, that data actually really belongs to First Nations communities. So it isn't something that should be shared, again, without their knowledge or consent. Sometimes the way we share this also depends on context. So for example, we share comparisons, again, with all those groups I mentioned within our reports, but we typically don't share these over social media because we have less room for nuance and less control over how the narrative plays out or how that narrative is shared across the interweb. So I don't know why I said interweb. I just thought it sounded funny. But there's a lot of talk about, again, this whole strength versus deficit-based framing, and rightfully so. It can be intimidating and it's hard to know what to do. But again, it's just really important to remember that there's a huge difference between these types of messages coming from a non-Indigenous organization versus messages that are coming from the community who the numbers are actually about, right? So just a few things to think about here. Also, this slide is long, so just bear with me for a few more points. When we talk about comparisons, we also think about things like standardization. So standardizing can be a really helpful analytical tool, especially when the age structure of two populations are really different. As many of you may know, this is indeed the case with First Nations versus non-First Nations populations. So First Nations populations are overall much younger. However, standardization can mask really important details or trends, especially when numbers in communities are quite small. So this was part of the reason we only reported crude rates for the mortality analysis rather than the age standardized rates. It's also important in kind of a higher level consideration to take a step back and think about what the concept of standardization really means. So in some ways, it's kind of implying that one population is the norm and the other is kind of deviant. So we need to change the deviant population to fall in line with the quote unquote normal one. I mean, people might not think of it that way because it's so normal to talk about standardization, but if you just take a step back and think about it, like you can see how it might imply something like that, right? So for this reason, we've decided to take a bit of a different approach for our upcoming analysis, the chronic conditions one specifically. So what we're going to do is we're going to standardize the general population against the First Nations population in our region. So kind of flipping the script a little bit. This means that we can still use standardization as an analytical tool, which again has so many benefits without obscuring the important details in the numbers and while kind of shaking up the power dynamics that are at play here. And we're really excited to see what's that going to end up looking like once we get more of those numbers back. So again, this was a long one. Thank you for listening. I'm going to pass it to Christina to talk a little bit about small cells, and then we'll move to the next phase.
Yeah, so as I'm sure you can imagine, that's one of the bigger challenges that we face working with this data, because the Mamo-Yawan population is a lot smaller, is that we run into challenges with small cells and we need to be strategic about how we suppress the data. And shout out to Yantao and Beth because they're the ones who look at the data and do the data suppression before we even get a chance to see it. So, and And I'm sure a lot of you on the call who do have to suppress data can appreciate the time it takes to do that. So sometimes we have to get creative with how we group the data, while at the same time we have to consider, is this grouping of data going to be meaningful to communities? And these are some of the questions that Yentao and Beth sort of ask, amongst themselves to see like how should we group the data and what is going to be most meaningful. So they had the internal conversations, and then how is that decision ultimately made? Well, so we're going to talk about a recent example that just came up from our chronic conditions analysis. And so when, as Maureen mentioned, we are trying to actually group people into whether an individual lives within a community, live outside of a community. And so maybe I'll just backtrack a bit. So as Maureen mentioned from the start, we're using the Indian Registry System, or the IRS, to link members from Mamo-Yemen communities with the administrative data held at ICS. And so having that piece, then we're going to try to work out and identify if a member from a First Nation lives within a community or outside of a community, and we're going to use geography. And so I'm just going to kind of give a high-level overview of this sort of challenge that we came across. And so once we started to actually look at some of the numbers, we realized that there was a third group of individuals who neither lived in a community nor outside of a community. And so we grouped and called this grouping unknown other. And so this is an example of people, for instance, who live outside of the province. And so we're faced with this challenge of small cells in this third group of the unknown other. And so we needed to figure out how we were going to work with these three groups or three buckets and what this meant for the data and for those who receive the data. So we had internal conversations to try to figure out how we were going to work with this challenge, because we had a few different options. And then most importantly, we brought these options to the steering committee, who are, of course, are the decision makers for this work. And so one option was we keep everyone in their separate buckets. And so we went over the pros and cons of each of these options. So, one of the pros, of course, is keeping everyone in distinct categories might give a clearer picture. But if we do keep everybody in these distinct buckets, because the population is small, we run into that risk of small cells in that unknown other, which then, of course, for those of you who do the data suppression know that you have to suppress something else or additional data because of that challenge when it comes to back calculations. So then it becomes a question of, well, how much information are we actually sharing if we keep everybody in the three separate buckets? Option two was to group those in that other unknown with those members living outside of a First Nation. So of course, we sort of talked about the pro of this, which, the data can be expressed and therefore less actually has to be suppressed. And it's easier from a knowledge translation perspective to share this information. But of course, a con means that there might be some of that nuances in the data that we can't actually see. So the next option was those in the other group could be then combined with those living within a community category. And so, of course, the pro for this is, again, the data could be expressed and not suppressed. But then again, we're missing some of the nuances of the data. And there was a fourth option where we basically don't even try to do this at all. And we just sort of maintain the analysis and try to not distinguish whether a person lives within a community or outside of a community. So the important takeaway in all of this is that we brought these options and the information, the pros and the cons, back to the steering committee and asked them for their opinion on what they thought would be best for this analysis. And so ultimately they, for those of you who want to know, they chose option two to group those who were in the unknown or other category to those living outside of a community. And so what this means, of course, is we can share a bit more information about what's going on without needing to suppress too much of the data. But again, the take-home point is this was their decision to make and the decision that they chose to come to.
Perfect. Thanks, Christina. Yeah, and also a good example of, again, creative solutions to some of these challenges, but also the importance of trying to think about and ask the community whether these kind of categories that we're creating to work with the data are still meaningful to them. So this brings us to the interpretation phase. Often communities and organizations with a lot of knowledge and lived expertise are left out of this phase. Someone just kind of looks at the numbers and goes with it. But community members have so much to offer in terms of context that can help shed light on the data. And I'm going to pass it again to Christina to share a story about this.
Yeah, so early on when we were talking about the mortality analysis, and this was a bit of a side conversation, but we were talking with one of the steering committee members from one of the regions, and they were, when we were looking at some of the information and the topic of physical activity came up, and talking about kids and the importance of physical activity, particularly in children. And she was saying, well, it's really tough for kids to be physically active in our communities because some of them, like, they don't have sidewalks, they don't necessarily, they have dirt roads, and so it's not necessarily paved, so it's not safe for them to ride their bike on the street. And so again, just bringing that context to the data helps in terms of understanding the story behind what the data is actually trying to talk about. And so that's one story that just kind of sticks out in my mind, because if you're in a community that has the luxury of having paved roads and has safe sidewalks and even bike lanes, then it's not something that you would necessarily think of playing a role when it comes to kids and their physical activity levels within the community.
Thanks, Christina. Yeah, I think that is a really good example. And one that Beth recently shared with me. She's given permission for me to share it, but if I get any of the details wrong, Beth, please feel free to put it in the chat or interrupt me. But one that really stuck out in my mind was based on her experience working with one of our organizations. They were looking at data on dog bites in an area with communities on both the mainland and islands. And they noticed that there was an increase in the wintertime around dog bites. And immediately someone from the organization was like, oh, well, that's because the ice freezes over in the winter, so the dogs can travel across more easily than they would be able to in the summer, right? That makes perfect sense. So yeah, it's just a really interesting example of something that makes perfect sense to someone in the community. But as Christina shared, if you're not from there, if you don't have that context, it's not something that would necessarily come to mind, right? So again, this co-interpretation piece is just so invaluable. Just want to also comment briefly on the importance of timelines when you're thinking about co-interpretation. It can slow things down, but it's, again, so invaluable. So it's really important to build in time for that from the get-go. So when you are planning out a project, you want to be thinking ahead and allocating as much time as you think you'll need and more to stuff like this. This is also important in other phases of a project too, not just interpretation. But this is definitely one that you really should keep in mind. The other thing is you want to make sure you're doing this co-interpretation before you start finalizing any type of report or knowledge product. So if this contextual knowledge doesn't make its way into those products, it's kind of a missed opportunity, right? So if you're waiting until you're sharing this back with the community and the reports have already been printed, it's cool to know, but it really doesn't get to shine in the way that it should, right? So just keeping in mind, like, the order of those things is very important. And a final point is just thinking about how you can create safer spaces for this kind of stuff to occur. So thinking about, like, who is going to be in the room? Do people know each other? Is there tension between these people? What are the power dynamics like? If people aren't comfortable, if they don't feel respected, if they don't feel safe, if there's a really big power imbalance. So if you have someone, for example, who is a health director and they receive funding, and somebody who is at the event is the person who decides who gets that funding, like, that's a huge power imbalance, right? And that means they're probably not as likely to share their thoughts. So just keep in mind who's in the room when you create those spaces. And obviously there's a million other things we could talk about when we're talking about creating safer spaces for stuff like this, but that's one of the main ones to consider right now. I'll let Christina talk about this, actually, because she was there.
Yeah, so this photo is actually from the co-interpretation session that we had in Thunder Bay, and you might recognize a person. I don't know, Maureen, if you could move your mouse over a certain person in the sitting in the front corner of the image. But yeah, so this is just a really great photo, just highlighting all the people and all the voices who came together to help in terms of the co-interpretation of the mortality analysis. This was actually the first look at the data and basically helped to inform how the final report was. It was the first draft, and so there were multiple drafts until we actually came to a final draft that everybody agreed upon. But then also there were a lot of really rich conversations that happened here to provide that context to the data that we were looking at. And again, just to give it that meaning behind the numbers. But also it was at this meeting that just helped to provide the direction for the next phase of the work that we're doing collectively. So again, a shout out to everybody who put in the time and the work to make that happen.
Thanks, Christina. Yeah, very important event in the history of the Alliance. So finally, this brings us to knowledge sharing. The name is a bit deceptive, I think, because you really should be sharing knowledge and thoughts and all of this throughout the entire data cycle, kind of like we've been talking about. But I guess regardless, there will come a point when you'll need to share final knowledge products with a broader audience. So a few things to keep in mind. Often knowledge sharing isn't given as much attention as other phases of the data cycle. Part of the reason for this is likely about what is and isn't valued, but there are also practical reasons. Maybe the project has already gone on a lot longer than you've expected, or maybe you've exhausted your budget, stuff like that. And again, like we said in the last phase, this is why it's really important to plan carefully from the beginning of a project. So make sure you're carving out money in your budget to knowledge sharing. Over budget for time, like I said earlier. So if you think a certain phase of the project will take 1 month, maybe budget 1.5 months or 2 months. It's always better to be done early than it is to be done late, right? And this is especially important when working with Indigenous organizations and communities. Things take time. Relationships are so important, and those aren't going to be built overnight. Another example, skipping from the first bullet point to the third, is the knowledge sharing phase needs to be iterative, right? So you should be prepared, as Christina kind of mentioned, in the way that we did our knowledge sharing and coming up with that report. You should be prepared to work iteratively with communities. So give them lots of opportunities to provide feedback and build that into your timeline. So Christina mentioned that people came together and provided feedback on the reports at that event. But what she also didn't mention is that there are plenty of other opportunities to provide feedback on those reports at different times of the project. It wasn't just that one opportunity. And really, that was so invaluable. I think like if there hadn't been so many opportunities, the final product wouldn't have been, it still would have been good, but not quite as good, I think. So really important, again, just budget for this in your timelines and in your financial budget, I guess. When you do budget appropriately, you'll have the resources to tailor knowledge products to communities' needs and preferences, going back to this second point. Often we default to writing reports. Christina has heard me talk about this so many times. There's nothing inherently wrong with the report, but it's not always the best way to share information with the audience you're working with. So really what you have to do is think about your audience and ask them about their needs and their preferences. So how are they going to be using this data? How do they like to receive information? Maybe they'll suggest something that you wouldn't even think of, right? We'll give some examples of how we've done that and how we're going to do that in these upcoming slides here. So again, it was really important for us to put a lot of time and effort into this knowledge sharing process because really this is the community's and the organization's data. If we're not sharing it in a way that's meaningful or a way that allows them to really make use of it, there's no point in doing this work. So in terms of knowledge products or physical products that actually communicate the results, we put together a few things. I think I've mentioned this once, but we created several different types and levels of reports. So you can see the maroon report at the back is the Alliance level report. We also created these green reports. There was one for each organization with just their data. The blue reports are community reports. We weren't able to do this for every community because some of them had to, the populations were too small, but we did this wherever we could. And then if you'll see, there is a landscape format report that's called the companion report. And that basically was a way for us to compare all of the communities across the partnership, just really showcasing the variation within and between. Just a quick note was that like all of the communities were anonymous in this, so we weren't sharing communities' information with each other. Again, that's not our information to share. Each community in that report was assigned a random number. So when they knew what their number was, but not what the other communities' numbers were, that enabled them to know where they stood in that kind of spectrum without compromising the need for privacy and data sovereignty. We also put together slide decks with the findings, and we created like a fun one-page summary infographic because the reports are long and not everyone wants to read very long reports. I'll talk briefly about the reports. We can't take you through every page, but I did think it might be worth putting this up on the screen briefly to highlight a few things. So the first is that it's way more image heavy than it is text heavy. This was important to us as our audience doesn't always have the time to read through all these pages. And this is also a little more eye-catching, a little more interesting, and maybe less intimidating for some people too. You'll also see on this page, there are a lot of infographic type layouts rather than graphs. So graphs are great, but they do take a lot of effort to interpret. So sometimes it's worthwhile to really take the guesswork out of it and to display like the thing that you want people to get from the graphs just on its own. But we also have a lot of examples of graphs too, because again, they can be very helpful when you want people to have access to all sorts of different breakdowns by factors like year, age, or sex. So there are a lot of line graphs that look at how different indicators change over time. As you can see here, we have some bar graphs. But we did create all the graphs very intentionally. So they all include summary statements to help reinforce the main takeaways, like you can see in the maroon text box at the top left-ish of the page. And we also incorporate other best practices in data visualization. This could be an entire course in and of itself, but if you want to learn more, we can always share the resources in the chat box or talk about it in the question period. But again, just something to keep in mind. Not only how are you sharing the information, like what format you're choosing or like what knowledge product, but within the knowledge product, how can you draw on best practices to make it as easy to digest as possible? So we're going to try this. It should, oh gosh. Okay, maybe I should have practiced this. Don't know if I shared my screen with the sound though, so just give me 1 second. This is maybe Christina, while I'm doing that, do you want to talk a little bit about the whiteboard video? Is that okay?
Yeah, sure. So the whiteboard video was one of the deliverables that the group decided that they wanted to have, is again a video or a visual representation, a very high level overview of some of the findings within the mortality analysis. And it's interesting because I was just talking about how the script came to be just yesterday or the day before. I think it was yesterday. And so it was interesting coming back to that reframing piece that Maureen was talking about. Originally, the script was different. And one of the steering committee members looked at the draft and said, because I guess it was more framed from a bit of a deficit-based sort of place. And one of the steering committee members said, I wouldn't show this to my mother or my aunties. Like, this is not, she felt pretty strongly about how it wasn't really, the information wasn't shared in a way that she felt comfortable sharing it with some of the elders within her community. And so we went back to the drawing board, pun not intended. We went back to the drawing board and sort of edited the script to reframe the language. So then that way, for a topic that is has the potential to be very heavy, that it is coming from more a place of strength and resilience. And in the end, I think it made for a much better product that 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 steering committee member would be willing to share with the elders in her community.
Thanks, Christina. Yeah, that touched on a couple of really important points. So thank you for that. And hopefully, yes, I'll press play and it will work.
Resilience, aging, and health in Northern Ontario First Nations. Elders in our communities know that aging and good health is connected to resilience and wellness, a balance between physical, mental, emotional, and spiritual well-being. For elders, good health is about sustaining Indigenous knowledge and oral traditions, intergenerational connections, empowerment, and identity. A well-lived and fruitful life is the foundation upon which resilient people, families, and communities grow. However, the impacts of historical and ongoing colonization on First Nations in Northern Ontario has led to a significant difference in how members of our communities experience aging and wellness. The journey for our people is different than for others in Ontario. While many of us have a good sense of the health issues affecting our communities, we don't always have numbers that reflect what we see and know. It's important for us to have these numbers, also known as data, so we can make better decisions about health in our communities. We are Mamo-a-Yamoan, everyone's voices. We are an alliance of First Nations governed health service organizations in Northern Ontario. We came together to provide the health data that communities need to achieve health equity. Our first project looked at the reasons why members of our communities are passing away. We found that compared to Ontario.
So I think I'll pause it there because you guys already know about this project and because we're running a teeny tiny bit short on time, but you can always go to our YouTube channel. It's just called Mamo-a-Yamoan, and like and subscribe, obviously, and watch the video. So just want to add one more thing to the knowledge sharing piece, which is that we can't just stop with the actual product. It's not just enough to make something. We also have to plan for how we're going to share it with people. Like, how are you actually going to get it in their hands or across their computer screen this day and age, I guess. And of course, do this in a way that makes sense for them. Again, this is a whole topic in and of itself. We've done webinars on just this, but briefly, some of the things you want to consider are here. So the first step for us was to share the findings back with organizations and communities. So this is where those slide decks came in, which we shared during interactive workshops and presentations. And doing this allowed people to ask questions and talk about what the results meant to them. So again, it became a little more meaningful. Some organizations asked us to do press releases to help them raise awareness about the inequities that they were experiencing and that the analysis uncovered. We've also presented at academic conferences to reach researchers. And finally, we've also started to use social media, mainly Facebook, to help raise awareness about our work and to make people aware that the reports exist. So it's a great platform to share things like infographics and the video we just showed you as well. If you're on Facebook, give us a follow. I'm the person who runs the social media. Obviously, I keep plugging us, but yeah, it's just one tool in our toolbox, but we did that very intentionally. So now we'll talk really briefly before we give time for questions about application. So hopefully you picked up bits and pieces about why this all matters throughout the presentation, but we'll touch on it briefly here. But when data is collected, analyzed, interpreted, and shared in a good way, organizations and communities can use it to inform advocacy and decision-making, which ultimately supports their self-determination as a whole. So when we follow these processes, they're also more likely to actually use the data because all of this was done to meet their needs. Their needs were at the center. And of course, it's only one piece of the puzzle, just to acknowledge that. We also need to consider people's lived experiences, traditional knowledge and teachings, and other kinds of information when we're making decisions about the health of our communities. But this is, as an alliance, what we focus on, and this is what we can contribute to that. And in case you're curious to know more about what this looks like, we conducted an evaluation to help us understand how the data is being used. So based on the findings, we know that the way organizations make use of the data falls into three broad categories. So the first is supporting funding or grant applications. The second is informing planning, whether it's at a high level, like strategic planning, or more concrete level like program planning. And this last category is kind of a catch-all for some really unique things that specific organizations have done. So for example, one organization told us how they use the data, and that is to, they've used the data as part of staff and volunteer orientation at their organization, which is really, really cool and a really unique example we picked up. And I'm just going to ask Christina to share a short story for you that illustrates how important this data can be when we're talking about funding applications.
Yeah, so real briefly, we were at, of course, this is pre-COVID, we were at a workshop where we were sharing information back with communities, and someone from Indigenous Services Canada was telling us about how one of the organizations use this information to fill out their Jordan's Principle application. And they filled out the application and they put in a lot of data. And then the person who was reviewing the application looked at it and said, where is all of this information coming from? Like, where are you getting all of these numbers? And basically they said, oh, we forgot to attach our report. And so they resubmitted their application and attached their copy of the Mamo analysis. And as soon as that person who was reviewing the application saw it, they thought, oh, okay, yeah, no problem. We'll immediately approve it. And so again, just highlighting how important this information is for this work.
Awesome. Thanks, Christina. And on that note, that is all we have in terms of the presentation. I think that's a really good and uplifting note to end on. We do have our information here if anyone wants to get in touch. And I guess we can open it up for questions. It looks like we have a little bit of time, so that's good. And I think that also Dorian's going to stop the recording so no one has to feel pressured when they're asking a question, or no one has to feel like worried that anyone